perfect. So this is Emily, and actually we're gonna do an upper blepharoplasty, non-surgical, by this new Alma Accent Prime technology, which is plasma energy generated by high frequency unipolar radio frequencies. So it's very, very precise, very high energy, and very precise for the upper blepharoplasty. Because what we are treating here is only dermatochalasis, so this is leg skin of the upper eyelid. This is the only thing that we do. So maybe you can lie down. So what we have used, we've used EMLA before, EMLA cream, and actually I put it mostly in the clinic for a while, for a half an hour, sometimes an hour. I have to say, in the clinic, I'm also using lidocaine by injecting lidocaine into the area. So in this way, actually, patients don't feel anything. Okay, so this is, and then the procedure is very, very easy. But now we're going to do just this. So what I'm going to do, I'm going to just clean off her EMLA, and what I'm checking is I'm actually looking at her crease. So my first step in this treatment is to make my border, and my border is the crease, okay? So first of all, I will go and I will just make a line for myself along the crease, and this is also the area which I would like to ablate. So the first part will be ablating part of the eyelid, and the second part will be contracting parts of the eyelid. So let's start and see if this goes. So what I will do, I will start laterally and then go. Is it okay for you, this energy?
Yes.
It's okay. So good. So I don't treat her with very high energy at this moment. And I will just make my borders first. You can see that there is a tissue reaction. Actually, you can also see the plasma sparks, which is very interesting because I don't touch her skin. Everything is in the air, and it's very, very mild. So this is a treatment that does take time in the clinic. So first of all, I'm just going along her crease little by little. I will check, maybe I can go a little bit higher with the energy because she was good with this energy. 1 second, I will just make the line. So I'm just going here along the crease because you don't want to go lower than the crease. You just want to treat the upper parts, and the crease is your border. So this is my first step, to make the border so that you don't treat the pretarsal space. You don't need to treat that area. You just need to take away some tissue she has in excess. I will just start to go a little bit higher because I can. She can tolerate this. So let's see. Yes, she can easily tolerate a little bit of a higher energy. So I'm just going along the crease and getting some coagulation and some ablation. You can see that some of the tissue evaporates. So I can go on. Actually, it is recommended to wear a face mask with this treatment because there are some fumes coming out of the tissue. You don't need, naturally, you don't need eye protection, also not for yourself and not for the patient, but you do need a mask to not breathe the fumes. So I'm just going like this, little by little. So what is important? What do you need to think about when you do this? So first of all, we want the crease to be visible because this is what happens with age, is that we don't see the upper eyelid crease. This is one thing. Then what we need to do is to actually have a pretarsal space. So this is also something that when there is more severe dermatochalasis, we actually lose this pretarsal space. And the last thing is to actually pay attention to the upper eyelid fold, which also should have a height and some volume and very, good looking skin. So it's very, very important to see all these, to look at all these parts. So can you maybe open your eyes so we can, so if you see now, if you look now, can you help me? I don't know. This one got out. Can you, if you look now, what you can see actually is that her upper eyelid is a little bit contracted, which is very nice. So she already has this mild lifting of her upper eyelid, and I can even go just a little tiny bit more to the lateral area to just contract here as well. And I think this is that's it. So that's it for this eyelid. And regarding follow-up, another very important point is the follow-up of the patient, so the post-op. So patients do need to know that they have some time at home for downtime. This takes like 5 to 6 days. So for 3 to 4 days, they're swollen. There is a very severe edema. I tell that to all my patients that they will be really, really swollen 3, 4 days. The 4th day, they will have little scabs on their eyelids, which will fall off on the 4th or the 5th day. So all in all, it takes between 5 to 6 days. That's it. And then people can observe the results. So it's quite fast and quite easy. So let me see this eyelid. This was had a little bit more of dermatochalasis than this eye, but really you can observe that it's already actually contracted and very nice. And maybe the result after she will come back will not be as good as what we see now, but then you can always do a touch-up. If I need a touch-up, I will do it around 2 months after the treatment. So I really let the tissue contract and do the remodeling of collagen that we want to achieve and to actually be better and rejuvenated. That really takes time. It's not an immediate effect overall. So I will start on this eyelid, and here again, yes, thank you. I will go and find where her crease is. So maybe it's okay, the energy for you? Mm-hmm. Yes. If it's a little bit too high, I can go a little bit lower. So I think I will go just a little bit lower because the EMLA was, and I'm looking here, you can really see the crease here. So this is my border. This is my first step. I don't go on the lateral side. I go a little bit and I make my border towards the brow. And this is how I go. And then this area I will ablate. So this is my more ablative energy. I do it with mostly a little bit higher on the energy in the clinic. So I will go to 7 to 8. And the setting will be 4 to get a little bit more of an ablative setting for to get ablation of some parts of her skin. This is important to get rid of this extra tissue overhanging the crease. And afterwards, I will actually go on and do some skin tightening by just coagulating. So that will be a bit of a lower energy. And I'm going and feathering the tissue actually like very lightly, just leading to tightening. I can say that this is very exciting for me to do this. I like this very much. We actually have really nice results. It took me a while to really think of how I do it, but it's really a nice treatment. It's not so difficult for the patient, and the good thing is that there are absolutely no scars after the treatment. So you don't see any signs of treatment afterwards. What we did see is PIH. This is something you have to warn the patient, especially your dark-skinned patients. Tell them that they may have some pH. I think about 10% of the patients will have that, but that will be temporary, and we give dark-skinned patients hydroquinone preventively to not have this problem.
Our sincere compliments, because you are like an art decorator. It is a very nice job. Compliments for that.
Oh, thank you. Thank you.
Very, very good. Okay.